When we highlight the neuropsychiatric complications that can occur in the autoimmune disorders, one of the aspects over here is the cognitive defects that are seen in the individuals who are suffering from the autoimmune disorders that are particularly attacking the central nervous system or that are particularly involving the peripheral nervous system of the body. So over here, when we've already talked about the multiple sclerosis. It's again going to affect the central nervous system, and obviously the cognitive deficits are going to be seen in the individuals who are suffering from such disorders. Now, when we talk about the cognitive defects, particularly, it includes the dementia on one hand. Then we can have delirium. We can have the anterograde or the retrograde amnesia that can be noted down in these individuals particularly. Over here in this section, we'll be focusing on the Huntington's disease particularly, and then we'll move on to the progression of this disease, how it basically clinically presents after the progressive increase in the symptomatology or the severity of the clinical picture is increased in these individuals who are suffering from the Huntington's disease particularly. Now, we'll also discuss the clinical picture that is quite peculiar to the disease, which is known as the Huntington's disease, and it's also known as the Huntington's chorea over here. So cognitive defects, they are present in almost half of the patients with multiple sclerosis. Usually what happens over here in the cognitive deficit individuals are the verbal fluency is affected particularly over here in these individuals. When you'll be taking out the history, you're going to observe that the comprehension of these individuals is also affected. So the thought process, the thought content of these individuals is affected. They're going to be forgetful about the naming of the objects, the naming of the people that are surrounding them. Then the executive functioning of the central nervous system is also affected in these individuals. Memory loss is one of the aspects that is observed in people where the cognitive deficits are observed along with the autoimmune disorders. So there is this range of difficulties in the cognitive functions, ranging from the comprehension, naming, executive functioning, and then we have the memory loss that is observed in these individuals particularly. Then we have the Huntington's disease at one hand. Again, the central nervous system is involved in these individuals. There is a frequent phenoconversion, that is after predictive testing. 4 times more than the normal population, suicidal rates are around the phenoconversion phenomena. What you can see over here in this picture, there is a normal normal picture of the ventricles at one hand, and then we have the ventricles of the person that are quite dilated over here. As you can see, this is the ventricle that is in the normal state, and then we have a ventricle that is dilated in the disease process of the Huntington's disease in the individual. Huntington's disease is not protective against the other disorders. So what is the progression of this Huntington's disease? The total functional capacity, there is the 5 domains that are involved. We have the occupational domain, then we have the physical domain. On the other hand, the activities of the daily life are also affected in people who are suffering from this Huntington's disease or Huntington's chorea. Again, there are these extrapyramidal movements that are quite hindering in performing the daily activities. When we say the daily activities are affected, then the occupational activities are sometimes also affected. If they involve the usage of the hands, then obviously the occupation is also going to be affected. The household chores are also affected over here. And then we have the residence phenomena that is also affected in these individuals. So these are the basic 5 domains that can be affected in people who are suffering from Huntington's disease or Huntington's chorea. So over here, you can see that Huntington's disease is basically an autosomal dominant inheritance is seen in this phenomena. If a normal female is going to get married to an affected male, what happens is that each child inherits a normal copy of gene from the mom and a normal or a defective one from the dad. So this is the probability that is seen in these individuals who usually get married. And sometimes if we have have a normal female at one hand, and if we have an affected male on the other hand, the possible combinations that we can see in the children are, on one hand, we can have the children with autosomal chromosome with normal copy of the gene. If they have inherited the normal copy of the gene from the father, then the autosomal chromosomes with normal copy of the gene will be observed in half of their children. Then the autosomal chromosome with defective copy is observed in children who are of the affected state or who are also affected by the Huntington's chorea or the Huntington's disease. So when MRIs are carried out on these individuals, on one hand, we have the controlled MRIs or the MRIs of the normal individuals with the normal ventricular space, and then we have the MRIs of the patients with Huntington's disease or Huntington's chorea, in which we can see the dilated ventricles that are observed in these individuals and that are again presenting as that particular picture of Huntington's chorea in these individuals. So when we talk about the symptoms that usually occur in these individuals, it can be the cognitive deficits that are seen in these individuals that can range from amnesia, that is basically the loss of memory that is observed in these individuals. Then we have people who are suffering from delusions. These delusions can range from the delusions of persecution, the delusions of grandiosity, the paranoid delusions are also seen in these individuals. Then we have the lack of concentration that is also observed in these individuals. The memory loss is sometimes quite frequently seen in these individuals. They suffer from mental confusion as well, slowness in activity and the thought process. The difficulty in the thinking and the understanding is also observed in these individuals. Then on the other hand, the muscular system is also involved when we talk about the Huntington's disease or Huntington's chorea. Again, we also emphasized on the fact that these patients suffer from the extrapyramidal side effects, and that are due to the abnormality in the walking phenomena. There is an increased muscular activity that is seen in these individuals. The involuntary movements is basically what is quite significantly seen in these individuals. Chorea is the word that was basically given due to that involuntary movements that are seen in these individuals. The problems with coordination or balance, they're also observed in these individuals. The loss of the muscle tone is observed in these individuals. Muscle spasms are also seen clinically. Then what are the behavioral effects that are seen in these individuals? We have compulsive behaviors, we have the fidgeting behavior that is quite commonly seen in these individuals, and then we have the irritability observed in these individuals, the lack of restraint. The psychological effects that are seen over here are the delirium, we have depression, we have hallucinations, and obviously the hallucinations again range from the auditory, tactile, the visual hallucinations that can be seen in these individuals. The paranoia, we have already emphasized on the fact that these patients have delusions of paranoia, quite commonly seen over here when they're suffering from this disease process. Mood disorders, they include the anxiety. Then we have apathy, that is the loss of emotions, or that is the facial expressions that is seen quite commonly. We have the mood swings. Also common are the tremors and the weight loss. Then we have the impaired voice phenomena seen in these individuals that are suffering from Huntington's disease or Huntington's chorea. So in this section, we summarize this particular autoimmune disorder when basically they have their neuropsychiatric complications as well at the other hand. So that is the end of this section. Thank you for watching sqadia.com.